Good to have calling in this morning from Lake Cumberland Regional Hospital for Doctors on Air, Dr. Rachel Shelton. She is the medical director of the Lake Cumberland Wound Care Center. Good morning, Dr. Shelton.
Hey, good morning, Amy. How are you?
I'm good. How are you this morning?
Great. Doing great.
Good. Thank you for taking the time to give us a call. So, Lake Cumberland Wound Center, when we're talking about wound care with the hospital, what kind of wounds are we talking about that you care for and take care of people for?
Well, we treat a myriad of wounds. We treat diabetic ulcers. We treat venous leg ulcers. We take care of traumatic injuries. We take care of post-surgical complication wounds. We will take care of wounds that the patient may not even know how they got it, so we try to help them figure that out. And I've even diagnosed a few types of skin cancers, et cetera, with non-healing wounds as well. So we will, take a look at things and see what we can do to get people better. But mainly we do venous leg, diabetic, traumatic injuries, especially in the summer, and burns. We do burns as well.
Yes. Now, do patients have to be referred to you, or can anybody who has a wound, or as you mentioned, something they're not sure what it is, can they come see you, or do they need to be referred to you?
Well, we do take referrals, but we can also take patients that are self-referrals. A lot of times it'll depend on the patient's insurance, but we do take self-referrals as well as referred by primary care or specialists.
And if people have a wound, whether they know how they got it or they didn't know how they got it, how important is it to take care of that wound before it gets worse? Should people pay attention to any kind of a wound on their body?
Well, absolutely, because depending on the location of the wound, it could continue to, worsen and then end up cellulitis, and some people even become septic and end up in the hospital with wounds just because they weren't treated or taken care of. And it's amazing when you cannot feel part of your body, like in diabetic neuropathy. It's not uncommon for that person to develop a blister on a part of their foot they may not be able to see or know about. And the next thing you know, it's worse, and it continues to worsen until they get bone infection and then sometimes require amputation, which we're here to try to prevent that at all possible costs. We really try to, keep that form and function going, and sometimes that's part of it too. If your form is off, then your function may be a little off too.
Now, at the Wound Care Center, Dr. Shelton, you're the medical director there. What kind of a team do you have? How many people are a part of the Wound Care Center at the hospital?
There's about 10 of us, and we have our PRN nurses that come in to help when one of the nurses is out or whatnot. We have a hyperbaric oxygen tech. We have Sarah at the front desk who does an amazing job welcoming people. We have just a group of great wound care nurses and staff, and altogether there's about 10 of us.
And you mentioned you take care of a lot of wounds post-surgery from people who have had surgery. What do you see? Surgery can be very difficult to heal from sometimes, and for some people it can take a while. So what do you do for people who are recovering from surgery and have those wounds to make their recovery time as quick as possible?
Well, as a general surgeon myself, I know how to create wounds. I know, thank goodness, how to get them better.
Yes.
But a lot of times it's due to maybe patient comorbidities, obesity, diabetes, edema and swelling in the location of the wound, especially if it's on an extremity. So a lot of times what we do is we have to figure out what are the factors that this patient have that we have to help overcome to get them better and get them healed.
And what would you advise for people? You alluded to this a bit already, but in terms of just taking care of your body in general and making sure that when you see something abnormal on your body, to get it checked out and taken care of?
So, keep a good close watch on your body, and it's something that we have to kind of get used to as we grow. And as with me getting older, it's like, things change, our bodies change, our health changes. So trying to stay as healthy as we can, being physically active when we can, and sometimes people can't because of, knees or different pain or things, but all those things help. And just, if you're a diabetic, keeping your glucose levels less than 180, I know better than that is optimal, but less than 180 for wound healing. And that's what I preach to my patients, because certain cells in our bodies that help us heal, help us fight infection, work best when our glucose levels are under 180.
And Dr. Shelton, do you treat and help athletes who have maybe been injured playing sports and they have some sort of a wound related to that?
Well, we definitely will see those wounds. I don't see a lot of healthy athletes because usually they do fine with recovery and surgery, but if there was an issue, we would be happy to see that person. We see, I've seen children, I've seen teens, adults, our senior citizens, our elderly. We've seen, several patients in different walks of life, from, palliative care to get me up and going so I can go back to work and provide for my family, or I miss my job, I miss my, my work buddies, so...
And where is the Lake Cumberland Wound Care Center located on the campus of the hospital?
We're located at 353 Bogle Street in Somerset. We're sort of at the corner of Hale Knob and Bogle Street. You'll see a big, large oxygen tank in the front, and that's our center there.
And Dr. Shelton, for people who might be having an abnormality on their body that might be a wound, might not be, how can they get in touch with your office and come see you if they need to?
Well, the one thing you can do is when you're at your primary care office is say, hey, what's going on with this? I've had it this long. This is what I think started it. But if they want to come by and let us take a look, they can call our office for a visit or a scheduled appointment. It's 606-451-3820.
Yes, and Dr. Shelton, you mentioned primary care physician, and I always like to ask all of the doctors that call into the hospital, from your perspective as a doctor, please tell people how important it is to get regular checkups, to find a primary care physician here in town, so that if someone needs to come see you, they can be referred to you.
Well, I always think it's important to keep focus on your health because, if you have a problem and you ignore it and let it go, then it can become, really bad, from your screening colonoscopies and mammograms to just daily what's going on with my body, taking a look. Like I tell my diabetic patients, have someone look at your feet. If your eyes aren't very good or you can't see the bottom, check out your feet. When you get a new pair of shoes, you got to break them in. You got to be careful, especially if you can't feel your feet. So it's really important to keep health, keep your eyes on your health, because sometimes things get far gone. It's so much easier to treat it when it's, a lot earlier in the course of the disease process than later.
And Dr. Shelton, how long have you been practicing medicine and practicing wound care here in Somerset and Pulaski County?
Moved here in 2008 and started strict wound care from a general perspective standpoint in 2014. I've been here at the Wound Care Center strictly 100% of the time since 2014.
Well, Dr. Shelton, thank you so much for taking some time to call in to the show this morning and remind us to take care of our bodies, check our bodies, and it's nice to talk to you, and we'll maybe talk to you again soon.
Thanks, Amy. Have a great day.
You too. That was Dr. Rachel Shelton, Medical Director of the Lake Cumberland Wound Care Center with Lake Cumberland Regional Hospital.